Start with normal red blood cells, perfect, flexible discs that slip easily through your veins. But sometimes a swollen giant appears among them. In medicine, this condition is known as Megaloblastic Anemia. It's a type of Macrocytic anemia, which means having abnormally large cells. These giant cells are structurally defective. Because they're bulky and fragile, they struggle to navigate the bloodstream and fail their primary job, carrying oxygen to tissues. When millions of these bloated cells enter circulation, the body begins to suffocate. To understand why these cells mutate, we have to look at where they are built. The bone marrow is your body's heavily regulated blood manufacturing plant. Every day, it produces billions of perfectly calibrated cells. A stem cell must first copy its DNA before dividing into two normal-sized, healthy red blood cells. But sometimes the DNA machinery jams. The cell can't replicate its core, yet continues producing proteins. It simply inflates, unable to execute the split. This failure doesn't selectively target red blood cells. White blood cell precursors get caught in the exact same trap, developing bizarre, hypersegmented nuclei because they too cannot properly divide. This is a bone marrow smear, and those arrows point to megaloblasts. These are giant red blood cell precursors stuck in an eternal waiting period. They clog the marrow, unable to mature, leaving the body starved for functional blood. DNA synthesis doesn't jam on its own. It stops because it's missing two specific raw materials, vitamin B12 and folic acid. This diagram outlines the biochemical pathway for DNA creation. You can see vitamin B12 right here, acting as a crucial catalyst. It works directly with folate to generate the molecular building blocks required to build a new DNA strand. We get these essential nutrients strictly from our diet. Folic acid comes from green leafy vegetables, while vitamin B12 is found exclusively in animal products like meat, fish, eggs, and dairy. If either of these nutrients is missing from your meals, the chemical chain reaction in the bone marrow breaks down. Cell division grinds to a dead stop. Swallowing B12 is the first step. This diagram tracks the supply chain transporting the vitamin through your digestive tract. Notice the stomach's gastric parietal cells. They produce intrinsic factor. B12 cannot be absorbed alone. It must bind to this biological escort to enter the bloodstream. This delicate transport system has a fatal vulnerability. In a condition called pernicious anemia, the immune system mistakenly attacks the stomach lining, destroying those exact parietal cells. Without parietal cells, there is no intrinsic factor. Without intrinsic factor, the body cannot absorb vitamin B12, no matter how much meat or dairy you consume. The supply line is completely severed. The nutrients pass straight through the digestive system, leaving the bone marrow entirely starved for the materials it needs to build blood. When the bone marrow fails to produce enough healthy red blood cells, patients develop severe anemia. With less oxygen circulating, they experience chronic fatigue, weakness, and persistent shortness of breath. This clinical photograph shows visible signs of the deficiency. Notice the extreme paleness and painful cracking at the corners of the mouth, called angular chylosis. Patients also frequently suffer from a red, sore, and smoothed-out tongue. While the blood cells struggle, the nervous system faces its own decline. Vitamin B12 is just as critical for maintaining the wiring of your body as it is for building blood. A severe B12 deficiency causes the protective myelin sheaths surrounding your nerves to decay. This leads to subacute combined degeneration of the spinal cord, resulting in a loss of vibratory sensation, severe unsteadiness, and eventually irreversible nerve damage. Left untreated, the condition leaves the body starved for oxygen, while the spinal cord physically degrades. To confirm the diagnosis, doctors examine a peripheral blood smear, like this one, looking for those oversized macroovulocytes. They also check the blood counts for an MCV, a mean corpuscular volume, greater than 100, which indicates the average size of the cells is clinically abnormal. Once diagnosed, doctors must follow a strict medical rule. If a patient is deficient in both, they must always administer vitamin B12 before folic acid. If a doctor treats with large doses of folate first, the bone marrow will start producing normal-sized blood cells again. The anemia resolves, but the underlying B12 deficiency remains. Without B12, the spinal cord continues to silently deteriorate until the nerve damage is permanent. A functioning, perfectly sized red blood cell relies entirely on an unbroken chain of molecular events. It links our diet, a highly specific digestive pathway, to DNA replicating inside our bones.